Blood pressure is typically measured with two numbers: systolic pressure and diastolic pressure. Systolic pressure, the top number, measures the pressure in your arteries when your heart beats. Diastolic pressure, the bottom number, measures the pressure in your arteries between heartbeats when your heart is resting. For example, a normal blood pressure reading is often considered to be around 120 over 80 millimeters of mercury. That's 120 mmHg for the systolic and 80 mmHg for the diastolic. Blood pressure readings are categorized as follows: normal, which is less than 120 over 80 mmHg; elevated, which ranges from 120 to 129 over less than 80 mmHg; hypertension stage 1, which ranges from 130 to 139 over 80 to 89 mmHg; hypertension stage 2, which is 140 or higher over 90 or higher mmHg; and hypertensive crisis, which is higher than 180 over 120 mmHg, and this requires immediate medical attention. To manage or improve blood pressure, consider these lifestyle changes and treatments. For lifestyle changes, focus on a healthy diet that includes fruits, vegetables, whole grains, and lean proteins. Reduce salt intake. Regular exercise is important. Aim for at least 150 minutes of moderate intensity exercise per week. Manage your weight by maintaining a healthy weight or losing weight if you are overweight. Limit alcohol to moderate consumption, if any. Quit smoking, as smoking increases blood pressure. Quitting can significantly lower it. Practice stress management techniques like meditation or yoga. Regarding medications, your doctor may prescribe medications like diuretics, ACE inhibitors, beta blockers, or calcium channel blockers depending on your blood pressure levels and other health conditions.